Again, nursing union Denosa is pleading with government to increase wages for its members. This call is coming as the medical fraternity is seeing an exodus of nurses and doctors. A large number are now seeking greener pastures overseas. Despite this, government is only offering a 2% salary increase. Let's discuss the state of affairs now with the union's Sibongiseni Delihlazo. Sibongiseni, good afternoon. Welcome to today. Thank you very much for your time this afternoon. Firstly, before we talk about why things are happening the way they are, you've noted, and as reported earlier in other media, this week, that you are getting more inquiries, or there are more inquiries from nurses about how they can work abroad. Is that the case, and what are they inquiring about exactly?
Well, good afternoon to you, Braden, and to the viewers at home. Indeed, that is the case, and I think as a country we are headed for a disaster if we are not acting speedily to resolve the challenges that are becoming push factors for healthcare professionals. Yes, we are receiving a lot of inquiries from our members and also from nurses generally who want to ply their trade overseas, specifically in the likes of UK, UAE, Saudi Arabia, Australia, and the likes. And this is concerning to us because it simply means that there are pushing factors. Well, we do know about them, and we have been raising red flags, but it appears as if nothing is being done to really get to the bottom of the push factors. Well, unfortunately, we are in no better position. We really cannot afford to lose the few healthcare workers that we have in the country, particularly your nurse specialists. And unfortunately, it looks like they are heading for greener pastures because we really do not have a plan to keep them into the country and to serve our patients in our healthcare facilities.
I understand that one of the factors, as I've seen, that will be driving them inquiring about overseas opportunities is not just the poor working conditions currently in the healthcare sector, but also pay, poor pay. And you've been negotiating for a 6.5% wage increase, but government is only proposing a 2% increase. Is that still the case?
Well, yes, but I think there's a slight move. I think we'll be announcing that very shortly, especially as the unions under COSATU are still consolidating our position, because if you remember, a deadlock was declared at the bargaining council because government was not moving with 2%, and the dispute was lodged, and the past 5 days, of course, we're looking into the matter, and it looks like government has slightly moved to about 3%. But I think more of that will be announced by COSATU at JMC. But even that, Braden, is far, far, far from where we should be going as a country if we are serious about keeping our healthcare staff. I think the unfortunate part about our country is that we do not seem to be cognizant of the fact that the essential workers that we have, fewer as they are worth keeping into the country. And once we allow them to leave this country, it becomes extremely difficult to get them back, not at the time when we are producing very low numbers of those specialist nurses, including healthcare professionals generally. And that is the reason why, for instance, on the 2nd of August, we saw the Home Affairs Department adding a number of healthcare professionals on the critical skills list, meaning that they will start to look elsewhere outside of our borders for those healthcare professionals to ply their trade here, as a government we could have done better to produce those ourselves.
Sibongiseni, if we continue on this track as a country in the healthcare sector, you said we're heading for disaster. I mean, already we're seeing pressure in the system, as you've pointed out. We are seeing the lack of training appropriately, no investment in that, including infrastructure. In your view, as a trade union that's involved here as Denosa, where do the solutions lie?
Well, the solutions lie in getting back to the basics. And the basics are to really invest in healthcare in our country. If you remember back then, I hope all of us still do, in 2011, during the State of the Nation address, the president then, Jacob Zuma, announced to the public that the government was seeing, of course, the ramifications of having closed the previously closed colleges. The government committed to reopening and refurbishing those. Up until today, nothing has happened. What lies at the core of our problems is because we've got very few institutions where we should be producing nurses in this case, and we've got very few institutions where we should be producing nurse specialists. Nurse specialists are very important because we've got many accidents, for instance, in this country, and many of our patients end up in ICU, but we don't have enough ICU-trained nurses. And we may lose patients unnecessarily simply because we don't have enough of those skilled nurses in the country. Therefore, getting back to the basics, reopen those colleges that were closed, ensure that the number that we produce as a country is in line with the recommendation from the World Health Organization, where it recommended that at least increase your output at least by 8%, each year, if you are to avoid catastrophe by year 2030, for instance.
So should we brace ourselves for more exodus, more departures of qualified nurses currently, who obviously are being sought after? Their skills are being sought after by the countries you've mentioned earlier, like the UK, but we can't keep them here.
I'm afraid. In fact, I think trouble is already starting because your recruitment agencies from the UK, for instance, are starting to base here in South Africa, therefore making the process of recruiting nurses from South Africa to the UK much easier than it was before. Now, that is brain drain, and we should be very worried as a government. In the absence of a strategy to keep on to these essential workers, unfortunately, we'll bleed more of skilled personnel to the developed markets, which can actually afford to produce them than we can as a country, as a developing nation.
Thank you very much for your time this afternoon, Sibongiseni Delihlazo, speaking on behalf of Nursing Union Denosa. The situation is not looking good at all.